what the fuck is birth and all the ways to do it.
I know nothing. Literally zippo.
What the fuck is a home birth? What the fuck is a midwife?
No one takes a ruler. So
I always thought that they were truly measuring.
So your vagina is at a give or take 10 centimeter hole.
no. There are several questions you can ask your provider to see if they're walking red flag.
What is a water birth?
I always say they're getting stronger, longer, and closer together.
Does no one know?
No.
Nobody knows?
Theory is that
How often do we poop?
I have a code word that basically means
If there was one thing that you could tell all women about birth, what would it be?
ooh. Okay.
I got a lifetime of knowledge.
Let me call Mimi.
Welcome to Actual Experts. I'm Caitlin.
And I'm Lindy.
And we don't have all the answers, but we're gonna ask the questions.
Today, we are diving into what the fuck is birth and all the ways to do it with actual expert Jessica Diggs, professional midwife, a topic that we know so little about.
Zippo
but
about.
that we hear so much about. I know.
I'm so excited.
When we posted it, people were submitting, being like, make sure you talk about this, make sure you talk about that, both moms and non-moms. So I'm really excited to get into it.
Yeah.
My first question for you to set the context is, do you know if you were a natural birth or a C-section?
Natural. I was definitely natural. Okay, wait, I'm going to pause this for 1 second. I told Steven I was recording. He's been doing weird speaker tests in the other room. Give me 1 second.
Oh, that's fine. No worries.
There was not an accident. Yeah,
It was not an accident.
I'm like, you
It was not.
true sound is not an accident.
Sorry,
Okay. Was I a C-section or not? I was a natural birth. I'm 90% certain of that.
Fairly certain. We can like phone a friend, call Verity, and be like,
Yeah.
what was I? And do you know if Julia was a natural?
I'm pretty sure we were both natural.
I was natural. All three of us, actually, Max, Riley, and I were all natural. I know my brother had the umbilical cord wrapped around his neck, so I think it was like quite a traumatic birth. But we were all natural because in Canada, is it as like in the U.S., at least when we were being born, and I think this is still the case, you couldn't elect to have a C-section. It was really more so like an emergency situation.
I need to look this up. I had never heard of that until we moved to South Africa, where people were like, I'm scheduling my birth. I was like,
Yes.
what? That's not what it's
And
like in the movies.
And in the UK, it's like you can choose, and a lot of women choose to have C-sections.
So apparently it is in Canada, which shows you how
can
much I
choose?
know. Yeah, at least in
Right.
Ontario, you can choose to have an elective C-section of the maternal choice, but the decision requires thorough discussion with your healthcare provider to explore the risks and benefits of a C-section versus a vaginal birth.
Okay, interesting. So the reason why I bring that up, because that's going to be a lot of, I think, the framing of this conversation, all the different types of ways to give birth. So natural C-section, home birth, water birth, epidural, no drugs, et cetera, et cetera. But amongst my girlfriends, there's 5 of us, I think we were talking about this, and they always joke that I am the one with the least anxiety, and we figured out at some point that I was the only one who was delivered vaginally, and the other 4 of them were all C-sections.
Oh my God.
They were joking that they were all like high anxiety people because they didn't get like whatever hormones or whatever, I don't know, nutrients like are delivered to the baby when it passes through the birth canal. I don't know if that's a myth or if that's true. We need to ask Jessica. Apparently, like the baby's lungs are squeezed and like the way that their spine realigns and stuff is like all necessary for proper development. And then if you get a C-section, apparently like all of that is just not part of the process. But we need to myth bust. So yeah, very interested to get into, and I'm going to read some actual facts and figures in a minute around the like rise in inductions and the rise in C-sections in recent times, and whether or not that actually impacts the baby and what the pros and cons are for different types of birth, and like why would you choose one or the other.
This is our 6th interview. This is the one I know the least about, which is so crazy. That birth is the one that I know the least amount.
Have you ever watched, did you ever have to watch a birth?
Yes, I think we actually watched it in science, not health class, who obviously did the like rewind, like what happens in reverse, just to like get everyone's reaction. It was like back up and all the boys were like, whoa, and yeah, it was hilarious.
Like literally North American health education system.
One of our friends, when she was telling me about her birth, because she went in thinking she didn't want an epidural, and she was like, I'm going to do a natural birth. And she got to the point where she was like, fuck this, give me the drugs. And she said that literally she was on all fours on the ground in the room, animalistic, heaving and grunting. And then she was like, give me the epidural. And they were like, okay. And then they started reading her the side effects of the epidural. And they were like, if you agree to this. And she's like, I agree to all of it. Everything. They're like, sorry, we just have to go through this. And they're like, line. And her husband was like, just give me the drugs. Like everyone's screaming. And then they gave it to her. But like, so crazy.
The stress, honestly, it's too much. So I know everyone has a different story with it, but there's lots that we need to learn, basically. So let me get into some facts and figures to kind of ground
Lay
this.
it on us.
Okay, so interestingly, in 2023, according to the CDC, over 32% of all live births in the US were via C-section. So that's what makes me think that they're probably more elective these days, because that's a lot to happen like through medical intervention, you know?
Is that an increase from before? Like, was it lower 30 years ago?
There were a couple other ones from the UK. So more than half of UK births in 2023 involved medical intervention. So that's over 50%. Cesarean, forceps, or ventouse. I don't know what that means. Ventouse. And the rate of cesareans rose from 25% in 2015 to nearly 40% in 2023. So like significant increase in the UK.
Is forceps, they have to like wedge your vagina open?
Well, a ventouse, also known as a vacuum cup,
No.
is attached to the baby's head by suction. No,
I can't.
not by suction.
Is that why they get the cone head? No, I guess
Like
the
the
cone head is
plunger?
from being
It says a
squished.
softer, hard plastic or metal cup is attached by a tube to a suction device, and the cup fits firmly onto your baby's head. Oh my God. I've never even heard of that. That's terrifying. So anyway, C-sections are on the rise. In the UK, another stat from the UK, in 2019, about 1 in 3 women were induced into labor.
Okay.
Whereas in the US, about 27% of pregnancies are induced, both elective and medically indicated. So very interested about inductions. In England, when labor starts spontaneously, 72% of mothers have a straightforward vaginal birth. But when labor is induced, that drops to 59% and the C-section rate rises. So it seems like there's a correlation between induction and C-section.
Okay.
Versus like when labor starts spontaneously in vaginal births. I think for me, honestly, my anxiety would be so much higher if I knew the time and date of the birth. Like if I knew like you're being induced on Tuesday at 4 p.m., I think that would be way more anxiety inducing than just being like, well, waiting till my water bursts and then water burst? What is it called? Water drops?
Water breaks. Your water break.
When my water breaks, correct.
Yeah.
Last one is that according to the NACPM, home births made up only 1.5% of all U.S. births in 2022. So it's probably around the same. So 1.5%. So really few home births. It's interesting.
I'm so curious. I have so many questions about this. I know nothing. I literally know nothing. I need to be educated from an actual expert.
From an actual expert. And I'm going to throw in some real questions like does everyone poop?
Yeah. Need to know.
Actually, yeah, I would like to know. Or maybe I wouldn't like to know. Yeah. So yes, a little intro to our actual expert today, Jessica. Jessica Diggs is a licensed midwife based in Los Angeles. She supports women and couples through every stage of reproductive health, from conception and pregnancy to birth and beyond. Jessica is working to make information more accessible and care more compassionate through Moxie Birth, which is a local birth center, as well as her online teaching and education. We'll put the info about Moxie Birth and Jessica in the description. Her Instagram is hilarious.
Yeah.
She's a great follow for education, but I just really like her vibe. She was introduced to us from Dr. Sarah Orek, who was our postpartum depression expert. And I think we're going to learn a lot from her.
Stephen did ask me, why is it called a midwife? And I was like, I don't know why they're called midwives. And we looked it up. Let me tell you. The word midwife comes from Middle English. It's built from two parts. Mid from the Old English meaning with, and wife in Old English simply means woman, not necessarily a married woman. So originally midwife literally meant with women, the woman who is with the mother during childbirth.
I love that. That's cute. Should we bring her on?
I'm so excited.
Please note that this pod is for educational purposes only. Nothing we say should be taken as financial, legal, or medical advice. Please do your own research, and when in doubt, ask an actual expert.
Thank you so much for being here. We're so excited to have you. I feel like you're a little bit of like a celebrity now that I've followed you on Instagram for so long, and now it's fun to have you on. So thank you for taking the time. Before we get into it, let me give you the lowdown of how this will go. One of the kind of unique aspects of this conversation will be that between Caitlin and myself, one of us, and that's me for this episode, has done most of the research and will lead the interview. And the other one has come in blind to effectively represent the listener.
Yeah.
So she's done no research at all. And we were laughing in our introduction. Caitlin was like, of all the topics, you would think that birth would be one that we like have some knowledge about. And we truly, we're not mothers yet, either of us. So this is going to be brand new for us.
Yeah,
which
we
is
know
exciting.
nothing. We literally know nothing.
I will kick us off by saying officially, welcome to Actual Experts, Jessica Diggs. Thank you for being here. The title of this episode, as we like to call them, is What the Fuck is Birth? And all the ways to do it. Truly, like, what the fuck is a home birth? What the fuck is a midwife? A doula, etc. So we're going to get into all of it with you today. Let's start from the beginning, really, more so with what's a midwife and how is that different from a doula, and then we'll get into the rest of it.
Yes, the classic question. Most people tend to lump us into a category with doulas because we truly share philosophies about birth. Doulas and midwives really do align when it comes to respecting and supporting physiological normal birth. So births that start on their own, births that need movement, birth typically without pain management, and then more so our approach towards supporting parents as they prepare for birth. So we're very holistic in all the body work and the care team that they need, and the education to make people feel confident walking into this very unknown thing. So both of you are not alone, where most of the time, the first time you're coming up to anything related to birth is your own. That's how we're just designed as a culture, where we don't really talk about it until we're experiencing it for ourselves. So I'm answering these questions all the time. So I always say that doulas and midwives share philosophy, but midwives' work is more aligned with the obstetrical, with your OB, with the obstetrical community. We are trained and competent in caring for everything from puberty to menopause. We can do your gyne care, we can do your PEPs, we can draw your blood, we can do ultrasounds, we can do abortion, and we can deliver babies. And people don't really realize that. In most other countries, the midwives run the show in obstetrical care, and OBs are only used for high-risk situations. In the United States, it's the opposite. OBs are doing all care, and midwives are underrepresented mostly, and people don't know about them.
You mentioned training. So what's the training look like for a midwife and the certification process for that?
Good question. So becoming a midwife there's a couple pathways in the United States, because there's nothing united about these states when you really look at it. In terms of licensure, it changes literally state to state. It's very infuriating. Licensed midwives or certified professional midwives, depending on which state you're in, they are trained exclusively in out-of-hospital settings, so home birth, birth center settings, and then they get a certificate of midwifery, and then every state has a different licensure that either requires them to take a test or just prove that they've passed their boards already, and then they can have a license in that state.
So then is a doula not then licensed in that same way? Is a doula considered, okay, is more like a holistic
So a doula
caregiver?
has no medical training at all. They are highly knowledgeable in terms of terminology and what's happening and what's kind of standard of care in birth and in hospital and out of hospital settings, but they have no clinical training. And you learn a lot just watching because you are there watching a ton, so they can speak to what it might look like to move through a C-section or what an induction process might look like, or what to expect at a hospital, but they have no clinical training.
And how long?
Okay.
How long did it take you to become a midwife? How long does the certification license take?
It took me 3.5 years. It's usually 3 to 5. It really depends on the clinic.
Wow.
People who have other obligations at home or just time restraints, it usually takes them closer to 5 years. I worked at smaller home birth practices and then finished off at a very busy birth center.
Okay.
What's a birth center? Yeah, is that different than a hospital?
A little different. Some hospitals will market their L&D space as a birth center because it's catchy and buzzworthy and great for marketing. But there can be some like in-hospital adjacent birth centers where they're going to be designed for low-risk patients. They sometimes have a birth tub. They typically are aligned with freedom of movement, and it sounds like the best of both worlds, but you still are subjected to hospital protocol that often has nothing to do with you as an individual. But it can make people feel nice and cozy and like they're staying safe and also getting some of the things that they really want with an unmedicated birth.
Got it.
The most common form of birth center in this country is going to be freestanding birth center. So it's a privately owned, unaffiliated with a hospital birth center. There's big beds. There's a birth tub. They're aesthetically pleasing. You walk in, you're like, yeah, I want to give birth here. The one that I work at literally looks like a day spa.
Love. Oh my God.
And
Okay.
it houses all of the medical stuff, but typically tucked away and not in your face. And ideally, you have a local hospital that's close and that you work with, but you're not necessarily affiliated with them.
Got it.
So
So they
interesting.
wouldn't provide like a C-section wouldn't happen at a birth center. You would maybe, if something happened, you'd have to then go to the hospital, which
Yes.
would hopefully be nearby. Okay.
Exactly. The birth center usually doesn't staff an OR, an anesthesiologist, and all the adjacent things that you would need for a C-section.
Okay, super interesting. What brought you into the space?
I have been a birth worker for almost 15 years. So I started as a doula because I thought I was going to be an OB. And it was like, JK, I actually don't want to go to medical school. But I started at 19.
Wow.
And yeah, so I was like actively trying not to have a child, didn't want anything to do with that, but I was very interested in women's health, and I was mostly fascinated with what we didn't know. So like this conversation is doing it for me. I
Love it.
was mind blown with girlfriends not knowing what was happening in their body from first and like weird early sexual encounters to a few friends who had babies but couldn't tell me about their births and why certain things were done to their bodies. They couldn't name those reasons. And it was mind boggling that they didn't know and no one told them. So I got into it from an education standpoint. I wanted to be the person that people could come to for information. So I worked in a women's health information center. I was like, I want to be a midwife, and the licensed midwifery program worked for me because I got to start immediately doing what I wanted to do, and have been a midwife for some years now.
That's so cool. And I think, to your point, the education piece of it and how little women know going into birth is like mind blowing. So that's why we're here. Have you found since you've started practicing that that has shifted, or do you find it's even still with clients, people who come to you who have as little knowledge as when you first started 10 years ago, friends of yours and clients?
Yes and no. Because now it's like, I would say many people still don't know much about their bodies, because I see people for conception. And so talking to them about when they ovulate, do they know when they ovulate? Can they confirm ovulation? I'm like, yeah, my app. And it's like, yes, your app still needs you to input data. It just doesn't tell you. It doesn't know your body. And so they're like, my app says I'm going to ovulate on this day. And I was like, but have you confirmed ovulation, you know? And so I find that people are still lacking the basic education around what's happening in their body. And I also am now battling with a lot of misinformation about what's happening in people's bodies. And so it's still education needed to put in context all this stuff that people are like, TikTok said is like a common
Right.
thing. And so I would say people are still not educated in their bodies, but are getting information from all types of places.
100%. 100%. Yeah, again, that's why we're here. So, okay, I think as a good way to kind of frame the conversation, taking us through, I have a couple questions around the labor process. First and foremost, what actually triggers labor? Is it the mom's body or is it the baby's body that says, let's do this? And then that will take us into like induction. Does no one know?
No.
Nobody knows?
Theory is that there is something, hormone secreted from the baby's lungs to then like, trigger consistent contractions. But then that doesn't make sense for preterm birth. So to this day, like no one knows the definitive catalyst. But what we do know is that if we talk full-term babies exclusively, there's definitely something in their lung development that does help, but also the hormones for the pregnancy do go down. So when you get pregnant, progesterone goes way, way high. That's progestation is like how I like to identify that hormone is what keeps us pregnant. It goes sky high. It's why people feel so tired in the very beginning and nauseous. That hormone is usually what's keeping you pregnant. It stays high the whole pregnancy. And then towards the end of pregnancy, usually around 36 weeks, it starts to come down. And people start to feel Braxton Hicks for the first time.
So what are Braxton Hicks contractions? They're basically practice contractions, your body's way of rehearsing for labor. They can start as early as the second trimester, but most people notice them in the third. They're usually irregular, not very painful, and don't actually cause the cervix to dilate. Think of them as your uterus tightening up and then relaxing, kind of like a mini workout for your womb. They can feel like a sudden hardening or squeezing across your belly, sometimes uncomfortable, but not truly painful. So in short, they're your body's dress rehearsal for the big event.
They're feeling a lot of sensation. Anytime I see someone at 36 where they walk in, they're just like, what is happening? And I'm like, it feels a little better next week. It's like, you feel the shift of hormones that you haven't felt for months. Like that cycle that we normally ride when we're not pregnant and it ebbs and flows week to week. People are riding high in pregnancy because they're like, that's not happening. So they're feeling really great outside of the bodily changes of pregnancy itself. But hormonally, people are feeling real good. And then it starts to come down. And so that shift makes the uterus more receptive to actually contract and to bond with oxytocin, which is our feel-good labor hormone.
So is the oxytocin trying to make you feel good about your contractions? Is that the idea? Because contractions hurt.
Yeah.
I don't know. But then oxytocin, you feel good.
It is similar to like, I don't know, I don't run, so I can't speak to this, but like a runner's high. People say they get high off running and they feel those endorphins. You have a cocktail of things, including oxytocin, endorphins, that get work on a positive feedback loop. It is more of a I am safe and I'm okay from a brain standpoint. Not that you can fully identify that and name that, but your brain is like, this isn't a broken toe. This isn't a broken leg.
Yes,
this isn't a tiger trying to eat us. This is a normal thing, and that's what the brain is doing. And this is why labor does that best at night and in safe places. So most people go into labor at night because that oxytocin can go up and not be countered by cortisol and any of the stress hormones that we typically feel if we're nervous or scared.
That is so interesting. Yes, I've heard that also around like birthing, like low lights are not just because people are light sensitive, like you're truly trying to create like the cave, so to speak, like go back to the cave days. Is really actually just my preferred way to live generally. So I'm glad that is conducive conducive to a good birth.
There's a lot about your normal day-to-day life that you can take into your birth and be like, no, that tracks.
Okay, so then when you get induced, do they choose to do that at night when it's more conducive to relaxed or oxytocin? It doesn't sound like it. And why would you choose to get induced if you're not like far along beyond your due date?
Good question. So an induction, because it's a process that's trying to get the body to do something it may not be ready to do for many different reasons, sometimes it's going to often trail into multiple days anyway. So the start time of an induction is neither here nor there. A lot of hospitals are choosing nighttime inductions though. A common induction time is like 8 to 10 p.m. So yes, but not so much because the hormones respond well. Mostly because the first part of that is very slow and often anticlimactic of an induction. So it's like you can check in and then they can sleep for at least that first 12 hours of nothing really happening. And it does help with hormones, but yes, it's mostly logistics and how the medication works. People are getting induced. Most common reasons are going to be medical concerns, which are going to be like preeclampsia, hypertension, high blood pressure, things like that.
Okay, preeclampsia and hypertension. Preeclampsia is a pregnancy complication that usually shows up after 20 weeks, and it's all about high blood pressure, which is hypertension. It happens when your blood pressure spikes and there are signs that your organs, especially your kidneys or liver, are under stress. In simple terms, your blood vessels and placenta aren't working quite right, which can limit how much oxygen and nutrients get to the baby, and it can make you seriously sick if untreated. Hypertension, or high blood pressure on its own, just means your blood is pumping too hard against your artery walls. But when high blood pressure starts affecting your organs or the placenta, that's when it becomes preeclampsia.
And then there's going to be preventative inductions. And that's preventative, quote unquote, to who's managing your care. So that might be someone who's advanced maternal age, over 35, over 40, and their doctor does not want them to go past their due date. And so they're inducing them early because there's added risk if you do go back past your due date. And that is one of those things that's very, I would say it's not subjective that there's added risk, but you can always individualize the care, and induction does not always need to be the solution. So in our practice, we have most of our moms are over 35. I would say arguably 75%. And what we do is we check in on this baby and this placenta because the risk lies with the placenta. And so it's like you can check in on that daily versus inducing them.
What does that mean, the risk lies with the placenta?
It ages, it doesn't function as well the later in pregnancy you get. But that is like a generalized correlation. That's it. And so your placenta and Caitlin's placenta, if you both were pregnant at 38 and you're both 40 weeks pregnant, they're two different placentas. We can't just say generally both of them are going to stop working in 3 days. That's not how bodies work. So we can check in and see, is this placenta still oxygenating this baby well? And if so, then we can stay pregnant because it may be doing its job. Those types of inductions happen more as a proactive standpoint, but not necessarily a need. And that's probably where induction gets this bad rep, is because there are a lot of those happening without giving that personalized care. That is hard to do when the system's not designed well for anybody.
Right.
And that's what is feeding the baby. That when you say it's not doing its job, it's like taking care and feeding the baby. Yep. And then when it's no longer able to do that, that's when it's time to go.
Yes. You want this kiddo out before that placenta decide, like, I'm not working today. Just saying, we want a baby out. And there's signs that tell us that the placenta is not doing its job well. Plus, the fluid is low. Babies aren't moving as much. And we can check in on those things with ultrasound and non-stress tests and, like, listening to their heartbeat. We can listen. We can literally know that, okay, this placenta is not loving this anymore. Let's get this baby out sooner rather than later.
And so with the rise then of inductions, we were reading some stats in the introduction about the rise of inductions. Is that correlated to older mothers on average, or is it because there's less personalized care, to your point, and people are just trying to get these mothers to like cycle through the system?
I would say the latter. And there was a big research study done called the RIVE trial, which wasn't really, it's controversial in how it collected data and then presented itself as a study. But basically, it said that there were better outcomes at 39-week inductions than 41-week inductions. And OBs took that and ran with it. So we saw a rise in inductions because this study said that these babies are going to be better if we induce you at 39 weeks. And many practices just started doing that without real reason outside of this generalized statistic. And in ours, where we give individualized care, we tell people about this study. We show them the data, but we also put it in context as that it was elective inductions for people who wanted it. Very different experience for your oxytocin when you want to do something. If you don't want to do something and you're going into something not wanting to do it, it's really hard to get the oxytocin on board. And no amount of medication can make it. And so, yes, we saw great outcomes with people who are like, yeah, sign me up. We're like, great, get this kid out of you. We want that for you too. That's your choice. Great. But if you don't really want that and you don't need it, then you're going to get some different outcomes.
And so for women who are going to hospitals, maybe not so much birthing centers, because it seems like that's more specialized care, are women within their own right to say, no, I'm going to wait, I don't want to induce, I'm going to wait until it happens naturally? Or are they, most often they're probably just following the instincts of their doctor? It's just hard to know when your doctors, hopefully they have your best interest in heart, but it's hard to know if it's just because they're trying to cycle you through, you know what I mean?
Yep. Yeah, I think that most people, because from the start of this conversation, are coming into this completely unaware of what is normal, what is needed, and their own bodies in general. There is a lot of distrust around pregnancy. In general, as a society, we have no idea what's happening in our bodies, and we're nervous and everything is going to harm this baby, which is just not true. On top of that, you have a provider who is saying this thing needs to happen, and not the context of that. It's not necessarily mandatory right this moment. It's not actually needed right this moment. It is a preventative thing. It's not usually phrased that way. If you do decline it, you have the right to say no. A good provider would talk to you, hold your fears, give you information, evidence-based care, and also say, okay, you can decline that and respect that. Not everyone's a good provider, and I would say a large majority are quite offended by you declining their recommendation. And then you get fear-mongering. And as a first-timer who may not be necessarily uneducated, but aren't as confident in their decision because it's your baby, you're vulnerable, you don't hold your own then. You're usually like, okay, great, sure, my baby's going to not be okay, so I'm going to do whatever you say, even if they do not have your best interest at heart.
Yeah. So in a practical sense, then, what's something that a woman in this position who's a first-timer, who's speaking to a doctor who's making recommendations, are there certain questions or like little, tests that can kind of generate like how much control should I really maintain?
Favorite thing is when I was a doula, early on, as early as possible, there are several questions you can ask your provider to see if they're walking red flag. Because it's gonna be in like game time 37 weeks that the red flag's really there and you can't change, and they know you can't. So you want to know earlier on. So my usual questions are, how do you feel about doulas? If they don't like doulas who are fucking walking fairies, like red flag. Red flag. There's no reason to not like them. And you can also ask, like, under what circumstances do you talk about induction? But you can even throw in, how do you feel about the rival trial? Because that's been the newest thing, and that really shapes how they feel about induction. And then see what they say, and what does it look like for someone to decline an induction with you as early as possible. It's going to feel like I'm asking these questions too soon, but you can change care providers the earlier you ask. And then the third one is kind of like, what does it look like for education, or how I'm best to be prepared for this birthing experience, and that you can ask whatever it is for your brother. If you know you want an unmedicated birth, name that. If you know you want an epidural, name that. I don't care how it gets done. You just want to make sure they're going to walk you through what is going to happen to your body in a way that makes you feel safe and educated. So asking them, like, what does it look like to walk me through that process? And if they're like, oh, we'll get to that later, and it's kind of like dismissive and brush it off, that's how they're going to walk you through that process. So those are the 3 things, and I'm like, as early as possible, you can clearly get red flags. But those 3 things of like how you're gonna feel seen and heard and cared for is more important than the actual outcome. Because I can't guarantee an unmedicated vaginal birth, even in the birth center. We have cesareans all the time. I can guarantee you feel seen. I can guarantee you understand why, and you're going to be cared for. Those are 2 different things. So that's why I'm like, it's less on the outcome and more of how are they going to care for you and like see you as a first timer.
That's so helpful. That's truly, if any women listening walk away with just that at the start of their birthing process and pregnancy process, I think that's tenfold better than what we're walking in with. So that's amazing. To that point, and kind of jumping past a big part of the labor experience, C-section versus vaginal births. They're elective. At least here in South Africa, you can elect to have a cesarean. I think the UK might be the same. We were talking about this in the intro. In the US, to my knowledge, they were never elective. Correct me if I'm wrong. They were mostly like reserved for emergency situations. Has that changed? And in what instances would you recommend C-section versus vaginal birth?
Yeah, it's so interesting. Most providers I know don't really want to do a primary C-section as an elective for most people because of the added risk of an abdominal surgery. There are situations where you always get the choice, for sure, that it's your body, but there's a lot of like informed consent around what that truly means.
What's a primary C-section?
For the first one you're ever having for your first pregnancy.
Got it. Okay.
Yeah. So ideally in obstetrical care, we're all trying to reduce that risk of a primary cesarean.
And is that because it affects the second child? Is that
It
why?
affects everything from how many kids we would advise you to have. You can always ignore advice, but it does affect how you give birth to your considerations for your next pregnancy and birth, how many, because if you have one cesarean, you can definitely have a vaginal birth after cesarean, but if you don't do that or choose another C-section, the more cesareans you have over time is more risk to the birthing person. So if you're like, I want 4 kids, the best thing you do is set yourself up to have a vaginal birth, because the risk to you at 4 cesareans is very high compared to 4 vaginal births.
And why is that?
Invasive
Why is
surgery?
it? Yeah.
Yeah. I would say it's major surgery. It's a very common surgery, but it's a lot of layers into your abdominal wall, into your uterine, and then you're caring for a baby. How it heals is one piece, and then in subsequent pregnancies you have a risk of the placenta attaching to the old cesarean scar on the inside, and it grows into that muscle, and then when it needs to come out it can be stuck, and that's a big risk of bleeding. And very big risk of potentially taking the uterus. Like, some of the most significant complications are going to be in this like shitstorm of a cycle of like the cesarean scar, their placenta attached cesarean scar, and this person bleeds too much, and then we have a hysterectomy. The risk of that goes up with more cesareans over time.
Is there ever an instance then that you would recommend a cesarean outside of a vaginal birth not being the safest? Like, a lot of my South African friends who were all C-sections were like, oh, I'm not dealing with that down there. Yeah. Like C-section, no doubt.
It's definitely been like kind of like, oh, it's not a big deal. I know in Brazil, it's like the number one way people are born. It's just like, you just schedule, it's done. It's cultural.
Right.
that doesn't mean it doesn't have its risk. I'm sure they also know a lot of people with complications that they are not really talking about, and the cultural connection to their vagina feels heavier and more of a risk than the actual risk of surgery. And that's just an anthropological thing of like women choosing to risk their lives to maintain their partnerships. And that's kind of the reality of what's happening in countries where they choose elective cesareans. It's not because it's easier, it's because the weight of social standing matters more.
Yeah.
Wow. Yeah.
And it's
Is
like
there
women in general across the world have been doing lots of things for beauty, including cesareans.
Yeah.
Wow. Yeah, that is crazy to think about because I just didn't know. I always knew it was major surgery and have heard, that like even several days after birth, like you're not walking, you're not maybe picking your baby up. And that's just not talked about, I don't think,
No.
as much.
And nothing's
yeah.
easy. It's not the easy way out. Nothing's easy. It's just it is gonna be down to in places where it is the way to give birth. It's cultural. Similar to here, give birth in the hospital. It's cultural. In many other places in the UK, depending on where you are, you have the maternity homes. There's lots of options. It really depends on what's most prominent around you and what the women around you are saying. It's like no big deal. It's not a big deal. You just go in. I did it. And then unless you're like, actually, I want to challenge that and go counterculture and actually have a vaginal birth, or I want to actually choose a birth center, then it starts to become an actual conversation, and that's you kind of going along with this assembly line of what's normal in your area.
Right.
But choosing a C-section here, the times in which I would recommend is like if there's truly a need to control how like the bleeding, or if there's things that might obstruct a vaginal birth, say there's a lot of fibroids or a lot of things going on in the uterus aside from a baby, then maybe we want a controlled environment like a C-section. Twins are a common one for cesareans. I wouldn't necessarily say that it's a medical necessity. It is easier for the delivering people and like a little bit more control because baby B can do some interesting things when baby A leaves, and particularly if it's a first pregnancy and you haven't had a vaginal birth yet.
And if the baby's in breech, that's also, I know there's an issue if the baby's in breech too, which means it's not
That's a common
pointing in the
one.
right direction.
Exactly, and their head is up and butt is down. A common one for a C-section. That is also not a necessity. We are just losing the art to deliver breech babies safely because our medical students and our residents are being taught it. So it's less safe because of competency or lack thereof, and they default to C-sections. So we're losing the art of that, particularly in this country. I can't speak to the rest of the world around breech birth, but yeah, those little stinkers are often born via C-section because they're not the right way down.
Right. Is there any truth to, I've heard that babies born vaginally get a certain amount of, I don't know, hormones delivered, or something happens when
Coding.
they're delivered through that, a coating or something through the vaginal canal that is good for them that they don't then get through the C-section. Is there any truth to that there's like some good things going on for the baby as they're like squeezed out?
Yes. I would say the biggest thing is vaginal flora. They get exposed to the vaginal flora, the bacteria that lives there, and that helps kind of jumpstart the immune system. You can still recreate some of that with them being skin to skin because there's skin flora, them you kissing your baby, you feeding your baby. So you can still make up some of that gut goodness in other ways, but they do miss out on that coating, if you will, when they don't come out vaginally. And vaginal health does contribute to mental health. There's a big correlation there.
Did you mean mother's vaginal health and baby's mental health? There's a correlation there?
There was
Or
a
you
correlation
mean-
to just gut health in general and mental health.
Oh.
And so if you're starting your life with a nice lump sum of some, then could be the case.
Got
But
it.
I also I don't subscribe to this idea that your birth is a deciding factor to your life's well-being, because there's lots of people who need cesarean births for many different reasons, and those kids are fine. They're going to
Totally.
eat dirt just like all the other kids. They're going to be just fine. And so I'm big on not wanting moms to feel added shame around choices or choices they didn't get to make. It's enough to raise a person. So I'm like, they might get a little extra coating, but I also like, you get coating doing skin to skin. You can still make up that kiss your baby, feed them breast milk, give them all the things. There's other ways to literally pour germs on them if you need to.
I love that. And the caveat of this all is that a healthy baby is the best baby and that the rest is, is less
added
important.
bonus.
So I appreciate that. Definitely. Okay, so then another kind of side-by-side comparison, epidurals or using drugs versus going natural. I want to talk about that. That to me seems like a more hyper-personal decision. I think of just whether you feel like feeling it all or you don't. Are there medical reasons to do one or another? What's kind of the key differences there?
Yeah, I would say is largely personal. There's not a medical reason in which I would say an epidural is needed. There's some reasons you can't have one. Actually, if you have really low platelets, you actually can't get one safely. And if you have really interesting spine or some surgeries in your spine, then you may not actually be able to get one. But I usually tell people everyone wants an epidural at some point. Like, it's a thing because labor is that hard. It is that overwhelming of a sensation, a series and combination of sensations, and it doesn't make you any less strong or weak to be like, that does sound kind of good now. I'm like, yeah, it does.
You're being offered the magic pill to take away the worst pain on earth humanly possible. Like a lot of people are going to take the pill, or
I also
snap their fingers.
For the start of childbearing, women have been trying to take away the pain in childbirth. If you look in all types of history books, from ayahuasca to peyote to what's our cocaine leaves?
Cacao leaves.
Yes.
Cacao?
Like all
Is that-
of the things, people have been doing some mind-altering medications to reduce the pain of childbirth. So this whole mindset of like, women have been doing it naturally because they didn't have an option, not because they necessarily wanted to. Like that's
if at the beginning of time there was a plant that could be smoked, it would have been passed around.
It was like, oh, it was a beautiful ritual. It was because they wanted the pain to be gone. So it's like that, like when people were like, I kind of want the pain, good for you. I'm glad we're on the side of medication where we have a safe option and you could totally have it. If you're like, I want to have an unmedicated experience, I want to move through this, absolutely. But understand that where you give birth makes a difference, because it is really hard to focus in on labor by itself, let alone labor in a place that's not designed to support you in an unmedicated birth. And in a hospital, there's beeps, there's lights, there's people coming in and talking about stupid stuff that you already didn't have, like your insurance card, and random things like, did you sign up for the program? It's like in the middle of a person trying to come out of you. That makes it a million times harder to actually have an unmedicated birth. So I always tell people, if they are wanting one and they're low risk, stay home, stay in a comforting place that allows your oxytocin to get to high levels, that allows you to find your groove, and you're going to the hospital to deliver the baby. Because if you don't need to be there earlier, there's nothing to do. They're literally like, why are you here? Do you want your epidural yet? Not yet. Do you want it now?
Okay, so you mean to labor, like go through the majority of the labor process at home where you can control the environment. And then at what point do you say get in the car and get to hospital?
Before we get to that, I also want to understand what's happening in our bodies during labor. Because we kind of spoke about the oxytocin part of it, but then and then I guess to Lundy's point, where do we go then to the hospital? Because I have no idea what's happening inside me when a baby is about to come out. Like what's going on down there?
Good question. So the giant uterus, your belly, the belly bump, the baby bump, is just your uterus that has grown exponentially over this pregnancy. It's a giant muscle, similar to your calf muscle. So when
Okay.
the hormones have shifted and the oxytocin is flowing, it causes contractions, which are literally just that, the uterus contracting. And you'll see it where it's like a belly looks soft and perfect, and then all of a sudden it looks very hard and contracted, where you can like see their abdominal muscles, and you can see like the baby's profile because it's contracted that tightly around the child.
Oh my
And
gosh.
that happens rhythmically throughout labor. So it starts kind
Okay.
of chill, where it's like, I'm feeling something, almost like crampy, because that's what's happening when you have your period. It contracts, but it's small, so you don't feel it, but in this one little localized spot. Now it's kind of all consuming your middle third of your body, and now you feel it everywhere. So that that contraction kind of builds, it kind of radiates up and then come down. So it looks very much
is it
like a wave.
And is the contraction doing that to push the baby down? Is that
It
the
is
idea?
it's a combination of pushing the baby down and pulling the cervix up. So think of a turtleneck. Your kid's head is the head, and then your cervix is the turtleneck. So when you have a contraction, it pushes the baby's head down and it pulls on the cervix, and the cervix starts to open and open to 10 centimeters. And 10 centimeters just means that it's behind this kid's head where they can come out of it. It's not an actual, no one takes a ruler. So it's like this.
I always thought that they were truly measuring, like ruler. No, okay.
On
It's just the
average,
concept.
this portion of the baby's head, the diameter is about 10 centimeters on average. It can be more or less depending on the size of the child.
So your vagina is at a 10, give or take 10 centimeter hole.
No. Good question. It's one of my favorite things to be like, no. You are not walking around with a 10 centimeter hole gaping out of your body.
What I'm picturing.
You're
Okay, so the baby's head is dangling out of my vagina at this point.
No, the cervix dilates to 10 centimeters.
Okay, and that's inside you still.
That's inside of you, and it's completely inside of you. Think of the uterus and cervix is connected. They're one body part, just different parts of the same body. Think of it as like a hot air balloon.
Okay.
The big portion is where the baby is, and the basket that's kind of mobile and stretchy and kind of move is your cervix. That
Okay.
port opens up and kind of recedes into the bigger port. It kind of does this, pulls up and around your baby's head. And then, so you feel that portion of labor. So the contractions are just making you get to 10 centimeters and pushing that baby down. And at some point, you're 10, baby still has to come down some more, and then you have to push them out. So then you're feeling the sensation of a bowling ball in your butthole. It's the best way I can describe it, because it's literally a head coming down to your rectum and back of your body and then coming out of the vagina. So the vagina functions as a curtain. Like this baby's ready to come out and like could be born, but the vagina literally only opens as the head is there and then closes immediately. It functions as a curtain. This kiddo, like if I part at your labia, I can see a head and some hair, but if I let go, it just looks like your normal vagina. And it's only as that baby is coming out, is it a hole? But it's a hole filled with a head, like coming out.
Yes.
And that's why you have to push
Yes.
push
So
it
you're
through the curtain.
You're pushing it down and through the curtain.
Okay.
Wow. Okay. And so different women obviously have different lengths of labor based on, and that's just how your body is like going through the motions. And so your cervix is dilating to get to that 10 centimeters, quote unquote, at a certain rate. And some women labor for 24 hours, and some women it's like 2 hours.
Yeah.
And that's just like how your body's doing it, right?
Typically, first births are always the longest for most people. Your body's not done this before. It has to figure out how to orient and coordinate those hormones to then give productive contractions to make that cervix open. Things that also help are going to be gravity, someone feeling safe enough where that oxytocin can keep going, because if they're nervous or scared for any reason, that does slow down. So freedom of movement does help. Safety and environment does help. And then like pelvic structure and things, like how people give birth, is largely aligned more so with their maternal lives. So there's always something you can always ask, like your sisters, your mother, what were their birth experiences like? Because there is a little correlation there, but then there's a lot of environmental factors too. So it's not always going to be a big predictor, but it can be helpful insight. If it's your second baby or subsequent baby, the cervix has done this before and it never goes back to pre-pregnancy, pre-first baby. So it's always kind of slightly opened, and it knows what it's done before. It's like you jimmied a gate and then you close it again, but you can still see like the little marks from when you stuck in the thing to get it open. It's kind of what happens with the cervix for a subsequent pregnancy. So once you kind of get in there again, it kind of opens a lot faster. So subsequent pregnancies are usually a lot easier and faster on the body as a general rule.
I interrupted us in that point, but Lindy, I feel like this is where your next question is going, is where. So
No, this
okay,
is, and also so interesting. I thought we were walking around with a 10-centimeter hole, and that's why we were like
A lot
all up
of
in the
people
hospital
do,
bed.
and I
So, like,
always like to like, no, that's not what that.
my mind is blown. So at what point then in labor do you suggest potentially moving from your safe space to the birthing center or hospital? And I'd also like to know, at what point in labor is it safe to get an epidural, and why is it too late for some women where they're like, nope, you've passed the window?
Good question. So if we are planning for a hospital birth or a person birth where you have to go somewhere and you know that you don't want an epidural, then the more active labor pattern you're at, the better. So you want contractions. They build over time. They build in intensity and in frequency and in length. So I always say they're getting stronger, longer, and closer together. So in the earlier phase of labor, they're maybe like 15 minutes apart. And then as you progress laboring at home, they go from 15 to 12 to 8 to 6. And they also go from being short, like 20 seconds, to about a minute long. So a good productive contraction is usually one that's building on momentum. So it's doing this to this baby's little turtleneck multiple times. You need that momentum. Doing this once every like hour is only going to leave the cervix in the same spot. So you need the momentum. So you want to get patterns. So I usually say contractions are about 4 to 5 minutes apart. They are consistently strong. They're at least a minute long, and that has been a pattern for at least an hour. I would even push 2 hours if you're a first-time mom.
Wow.
So it's a lot of the labor done at home to get to that place. And if your partners are watching, like you can see the transition for what labor looks like. In the beginning, they're like, ow, that kind of hurts. This one feels like they're describing it to you very early. It's very early versus like they're mooing and they're making primal sounds when they have one. They're not talking to you even in between them. That's a good active pattern. It literally transitions where it's like, she was here and now she's not.
And she is no longer with us.
She's not with us. And that's where you want to be. I'm like, we don't give birth in our frontal cortex. If anything, of going back to the cave, we're going to our hind portion of our brain to give birth. That is where we give birth well. We can't think our way through birth. And I see people try it, and I'm like sitting in the hallway. I was like, oh no, she's taking on labor. She's going to lose. Who's going to tell her? Stop trying to fight it.
Not going to work.
You can't power it. You need to get out of its way. And if you're wanting an unmedicated birth, you have to be mentally prepared for that. It is a big, deep surrender. That I hate saying that because it's not really my personality, not that woo-woo, but like you actually have to get out of its way. Like you have to just do this thing. And so that's when you will head to the hospital. If you're wanting an epidural, it may be a little earlier than that because you typically need a little support getting to that phase. But you also don't want to be there too soon. So I usually say between like 5 and 6 minutes apart, and they're getting stronger. There's been a progression in intensity. That's usually a great time to get there, where you're getting there in a comfortable spot where you're not hitting suffering. Because if you truly want that epidural, the best thing we want to do is get you that epidural where you're in a place where you're not traumatized by this experience. But you might have to work hard in the very beginning, which is okay. And people can do it. They often are shocked and proud of themselves that they got like a portion of the way done without their epidural. And that's the best thing you want for a mom going into this, to feel like, I did something. I did good. And like, yes, you did, honey. You got that. Get your epidural and enjoy it.
Love. And then how long does it take for the epidural to kick in? before it's effective, because sometimes they're
typically
like,
takes
it's too
about
late.
15 to 20 minutes. So the times in which it's too late, we don't have that in our practice. You have to be like pushing out a baby before it be too late. So
Yeah.
even if you were 10 centimeters, but you weren't actively pushing a baby out, you still could get an epidural, sleep for an hour or 30 minutes, and then push a baby out.
Yeah.
So
Okay.
most of the
That's
time when
good to
it's
know.
like too late, it's usually a hospital policy situation. It's not a clinical reason it's too late. It's very rare, and the only one would be that the kid is about to be born, which is like, great, get it out, you know. But depending on where you are, if you're in places where there's not an anesthesiologist that's on 24/7, then it can be too late because it's hard to get them in the room, get your IV, get to all the things, move through all the steps to get an epidural, and then to take the 10 minutes to 15 minutes for it to work well.
Got
it.
Okay, amazing. So one of the questions that I think honestly was asked the most is, what are your partner's role in this? They can't take away your pain. I've heard the analogy that their job is to like protect the cave and like keep the lights low. What would be your advice to the partners in this process?
Good question. My usual advice is you're in charge of understanding birth. So because the person who's given birth is going to take all these classes and read all these things, and in labor they're not going to remember any of that. They're not supposed to be recalling. They're not in the same brain. So it's your job to like remind them, remember, we're waiting to 411, or we're waiting to go to the hospital at this time, or remember that like transition, which is the last part of labor, is the hardest part. And you remember vomiting is normal, and we read about this. So that the things that come up, because labor is weird. It's a lot of stuff. And like, yeah, blood is finally a good sign in labor. Like the entire pregnancy, you've been told blood is scary, and now you're bleeding.
Right.
And like, good sign. You know, a little bloody show, not a ton of blood, but like, your cervix is doing something. So like reminding them of the things that are normal so that they don't have to panic or, you know, second guess themselves. So educating yourself with a partner is going to be helpful to normalize what's going on and remind them of that. And then basic bio needs, reminding them to eat, drink, take small bites. It is a marathon, and it's literally a giant muscle working. So think of them as athletes. They need hydration, they need snacks throughout this process. Know your birth plan, know what they wanted from this experience and why. Not just like, I think this person you're procreating with obviously wants a healthy baby. So know why they might want unmedicated birth or why they want to avoid a C-section beyond what you want to for this baby. Like, you don't want to default to your own anxiety and fears and that trump this person's birthing experience. That is a recipe for divorce and deep-seated resentment. I see it all the time.
Yeah.
So it's like, yeah, you're like, I'm picking the baby. It's like, cool, you did. And that's your divorce. You still got the co-parent though. Cool. You
I'll
picked the
remember
baby.
that.
Yeah, like that is the reality, is that she's going to remember that forever. So remembering that you can if the things need to pivot, you're her safe space, but you're not like, you should just get the epidural. You're not really coping. Like that is, she's going to feel like you didn't support her. So knowing why, not just what she wants, will really help you understand of like, okay, if she doesn't want an epidural, I need you to give me some parameters around how to support you. And some of my favorite was to have a code word. Because it is really hard for a partner to watch the person they're in love be like, I'm okay, as they scream bloody murder every contraction. And you'd be like,
Right.
You're doing great, I think. You know, it's really hard for you to know. It's your first experience too. So have a code word that basically means if they don't want an epidural, then your job is to keep distracting, to keep offering comfort measures and all the things you learned, hip squeezes and all the things until they say the code word. And when they say the code word, you shift gears and you get that nurse in here, you get them the epidural, and you praise them about how strong they've been. But now you're like, let's get your epidural, babe. Let's do this. So you know what to do on either side of that. You're like, I'm going to keep supporting this because you wanted this and I want this for you. And it looks hard, but it's not about me. You can do this. And if they shift it, great. That's good. You did so much of this without it. Let's get you an epidural so you can sleep. So that's like one way in which, as a partner, you're like, I don't know what I'm doing, which you don't, and that's okay. But having some type of good conversations around what does it really look like to support you well in this, and also what does it look like for me to take care of myself mentally, because I'm going to be watching the person I love in pain for a day. I was like for 24 hours and not be able to do anything about it.
Right.
Yeah, and then also the last
great advice.
Hire a doula so you don't have to have all the answers. Hire someone else who's an expert at birth while you get to be an expert at her. And together, you kill it in this birthing experience. You have this doula who's going to make sure you remember all the little things and remind you to get the water and remind you to shut up and that your joke isn't funny, or now's the time to tell that joke. And it's just going to be perfect. And then you also can say the sweet everythings that the doula can't ever say without it being quite awkward, that together this person's so well supported. And so that might be the thing that you do for your partner is actually, let's hire a doula so that we are both supported through this experience. And I know what to do and what not to do, so that we don't have an experience where there's a lot of resentment.
Yeah, that's so important. And it takes some of the pressure off of the mother from being like the most educated and like the most, in the know. To your point, it all goes out the window in that experience anyway. So
you won't be able to do that for them.
Send this episode to your partners. Ladies.
Yes, exactly. Can I ask a quick question? I wanted to know, what is a water birth?
Good question. It is when the baby is born into water, typically a bathtub or a birth tub. So instead of pushing on dry land, like in the bed or in a squat or whatever, you're doing that in a big tub of water. The reason most people get into the water for pain management, submerging yourself in water during that contracting really helps to take the edge off. When people are choosing the birth center or home birth and they're like, no drugs are available, there's still pain management options. They're just not pharmaceutical. And the water is typically a big one. I always tell people, just next time you guys take a bath or get into a hot tub, that visceral like happen when you're in labor is a game changer. And so people tend to like it for pain management, and sometimes they start pushing in it and they have the baby in the water.
So it's not necessary. I always thought it was because people were like, oh, the baby's moving from one fluid into the next fluid and it's less dramatic for the baby entering the world. It's more for the mother's sake.
I would argue it's more for the moms. Yes, the baby has a gentler experience. They still have to transition once they get out. Like, we got to pull them out. The transition has to happen. Like, stress is designed for those lungs to function well. I'm always like, look at an elephant give birth. They like kick the thing around for a while because it's helpful for their lungs. So the baby needs some aspect of a stimuli. Sometimes that is just emerging from water to air. And so it's going to happen. It's just like a little shorter delay. But I would argue it's much more for the mom, their tissue. It helps the vagina stretch when that kiddo comes out and reduces tears. It really helps with pain and really helps their body like come down. We see blood pressure just like go down a little bit. It's just really nice for the mom.
Okay. Great. Very helpful.
Yeah. No, that's a great addition. Thank you. So our last question to all of our actual experts is, if there was one thing that you could tell all women about birth or preparing for birth, what would it be?
Ooh. Okay. I think mine would be give birth the best in the place you feel the safest. For some people, that is truly the hospital. There is no convincing them that out of hospital is safe for them, and they're going to really relax into their birthplace, and oxytocin is really going to flow when they're in that setting. And that is true for home and birth center. You're going to give birth the best in the place you feel the safest. I'm never going to try to talk you into home birth because I don't believe it's the best place to give birth. The best place to give birth is where you feel the safest. And really doing some digging on what that means to you. Safety is going to look like, who do I want to puke in front of? Who do I want to take a shit in front of, potentially? Who will I feel the most safe in terms of competency, or who do I align with in terms of philosophy around birth? knowing that anything can happen anywhere, you still can get a competent provider in any setting. So really, truly checking in with yourself of like, where do I feel safest? And that is going to be unique to the birthing person. You may need to take in consideration of your partner, but that's a very slight consideration, quite frankly, because they aren't giving birth.
Right.
And a lot of people, I just had a consult right before this, and it was like, my mom is saying this, and my partner is saying this. Their fears are not going to be alleviated in the hospital either. You actually may have a better chance of alleviating them with personalized care. Someone can speak directly to them. And so I always tell people, you need to look at what makes sense for you. And then if there's a true discrepancy in a risk tolerance with you and your partner, then them educating themselves around what that really looks like and finding the best fit. And sometimes a happy medium is a birth center, because it does have a different layer of sense of safety that home doesn't have for people who are truly challenging the culture around birth. Even though home births have the exact same equipment, we just bring it to you. But the birth centers, for whatever, feels like you have to go somewhere to give birth. And that can be a nice happy medium for couples who are having a little disagreement around what feels safest. But at the end of the day, there's no one place to give birth. It's truly where you feel the safest.
Yeah, that's great. It's know your options, I think. Do your research, know your options, have your support around you in all the forms that it comes, and happy baby, healthy baby, and congrats to all the moms. This has been so interesting. Jessica, thank you so much. I've learned so much, truly. More than I expected.
Now I know I will not be walking around with a giant baby's head dangling out of me on my way to
nothing.
give birth.
That is great.
Literally, I'm like 10 centimeters. The size of this bowl will be my vagina.
Yes. Many people think that. You're not alone. You're not often. I'm like, that's not what happens.
Yeah. Now I'll explain the curtain analogy, and everyone will be better for it. But truly, Jessica, thank you. We would be so lucky to ever work with a midwife such as yourself. So we will spread the gospel and have everyone listen to this. Thank you. We'll send people your way. We'll include your Instagram in our description. We can include maybe your LA birthing center, just in case people are local in LA. That's where I grew up, so I have lots of friends on that side. And hopefully we'll get to meet you in person at some point soon. Thank you so much. We appreciate it.
Thank you, guys. So lovely talking to you.
Welcome to the Debrief, where we discuss things we needed a little more clarity on.
Notes from the thing, so that's fine.
Okay.
Yay.
So yay,
Hello.
we're back. We're back, and we
Talking
know
about birth.
a whole lot more about our vaginas than we did, but than we did it going into it. Truly, I know.
I think that might have been one of my favorite episodes because it was so hilarious. I feel like I laughed so much going through this purely at myself. I was laughing at myself.
It's also just crazy how little we know. I mean, honestly, the universal truth, like the source of all life, the crux of literally what human beings are here to do on Earth, and like no one knows.
No one knows.
It's like just ridiculous
Until
to
it
me.
happens.
But learned so much. Jessica is so incredible. Loved her. What, like, would you not want her in your birthing room? Like, I want her on my birthing team.
Yes. I'm like, guide me through birth, please.
No, truly. So I know we'll make sure that her contact info and her birthing center and stuff is in the description. But yeah, we have some takeaways. Do you want to start? Because I read this one.
Well, yes, definitely. Probably my biggest one is that my vagina is not going to turn to the size of a 10 centimeter donut. So I am calling fake news on this, not on her, on another podcast I was listening to where it was a couple talking about what birth was going to be. And it was a celebrity couple. And I guess this solidifies why you need to listen to actual experts and not a celebrity couple. And they were saying, she was like, did you know my vagina is going to be the size of a 10 centimeter donut when I give birth? And I was listening to this and I'm like, I'm going to walk around with a baby hanging out between my legs.
I know.
To the hospital.
That's what I was picturing, honestly.
Yes.
And that's why I was always like, Luke, you're going to be up. I mean, he's still going to be up in my head anyway. I don't need like that much detail, but like it does make me feel better that it's not just a gaping hole.
Yes. Yes.
Gaping.
So that for me was probably my biggest takeaway. My other takeaway was about water births. And I thought water births were so that the baby would like flow out of you into water, from water into water, and be one with nature for longer, all those things. So it's nice for the baby, but turns out it's more for the mother to help with pain management.
Yeah.
So I like that. I went on a walk with Stephen after. I was like, maybe I should be sitting in a bowl of water right before I get
No,
birth.
I was always like, I don't really want like all the stuff and the thing, and like I like that's not my vibe. But I agree. Honestly, it sounds kind of nice now.
Yeah,
It's just like
I know, a nice
floating
warm
around.
bath.
Yeah.
Yes. I honestly feel like there were so many things that I knew nuggets about and little bits that I was trying to like put together in my brain. But I think I always just felt too embarrassed to ask anyone these questions because it feels like you should know the answer, especially about birth. So I very much love this conversation because first of all, Jessica is hilarious. And she had such a great sense of humor taking us through that because we were idiots and knew nothing. And yeah,
she said that
literally nothing.
she said most women don't truly, and that yes, either we feel like we should, or otherwise like it always seems like a little bit too far off, at least for me. So I've never asked, but then maybe by the time I got there, then I really wouldn't ask. So it's just, I know it's crazy how little we all know. Okay, I have a couple takeaways, some things that I did not realize. First being that having a C-section greatly impacts your next birth.
That was
And
crazy.
so the more kids you want to have, the better you should set yourself up for a vaginal birth. Didn't know that. I again, we knew it was surgery, but I didn't actually know like how your like multiple births were correlated. I really appreciated her advice that you speak to your caregiver or your doctor or your physician early, and you do all these temperature checks about what kind of physician they are and whether or not they check your boxes early on in your pregnancy, because at 37 weeks it's too late to change and you're locked in. So she was like, speak to them about inductions, speak to them about how they feel about doulas, for example, as like a temperature check. I would never have thought to do that, and I really like that, and I'll definitely use that just to get like an understanding of how they're going to approach it, and make me feel supported. The other things that I really like that she said were that partners need to be prepared, yes, so that they're supporting you, but so that they also don't get scared through the process into making a decision that then you are going to resent in the future. So like, she's in pain, just give her the epidural. I don't know, like it's freaking me out, versus like have a code word. Your job is to support her through this and not, you know, don't change course. There's something. Yeah. Don't change course unless she gives you the nod, but there has to be, you have to plan for it as a partner.
I feel like also in that scenario, to what she was saying, where you're watching your partner in the most pain that they'll probably ever be in their life, and your natural instinct is to fix it.
Yeah.
And I think that also comes to trying to fix your own uncomfortableness of like,
Totally.
I'm uncomfortable, I need to fix this as well. And she should just take this drug, or she should just do this thing, and all of us will feel better. And so I really appreciated that of how to be prepared in advance. And she said having a doula in the room can also help with that.
Have a code word. Yeah, exactly. She said, I wrote down, hire someone who is an expert at birth so you can be an expert at her, which I think is like, I so appreciate that. I mean, it's probably, I think, a luxury for a lot of people, but to just have someone whose job it is to know the ins and outs so that you can focus on just being the support system, I think is a nice way to look at it.
Well, Jessica is a 10-star gem. We love her.
We love her. And there's so many other things that we could go down in terms of birth, but I really do feel like I got a good baseline, and hopefully you did too. Yeah. Thanks for being here.
Love it. Thanks for being here.
See you next week.
Let's fucking go.
Woo!
Coming next week, we're asking, what the fuck is blockchain? With actual expert Elaine Asher, co-founder of Eve Wealth. We break down blockchain versus crypto, why stablecoins make money move faster, and why women can't afford to sit this one out. Next week, Elaine gives us exactly what we need to feel comfortable taking the first crypto step. Listen in next Tuesday.